Good evening, everyone, and welcome to part 2 of the NEET PG full-scale grand test. Harsha and Zulfikar Ahmed. We have 2 players ready for a fight. Let us see who is going to be the winner. And Manisha Bal Subramaniam. So, Manisha, what you need to do is please call 9000-868-356 to get the link. Call 9000-868-356 to get the link to the game. Link to the game. Okay? So, even after the quiz started, any moment, you can be able to join the game, no worries. But invite all your friends, tell them that there is a boxing match. Are they ready to join the boxing match? So let's make the great beginning without much of delay. So, doctor, let us start. Right. I'm able to see why, who gave a great competition to Harsha and Zulfikar in the last game. And those who could not, who want to have to play it like a quiz, please give a call or WhatsApp quickly to 9000-868-356 in order to join the game. Yes. So, shuru kare? Yes, doctor. All are true about Fragile X syndrome except large head, large nose, large ear, large testis. What is not large? Boom. Only one is right. The other said large testis, but large nose is not the feature. So good. Harsha Vardhan is climbing up very fast. So those who want to play the quiz, you want to play the quiz, you want the link, play the quiz, want the link, call 9000-868-356. Okay? So I just need to make a habit for you of our process to get the link. If you want to play the quiz and want the link, call 9000-868-356. Yes. Let us make the Again, doctor, the next question. AL type of amyloid, where you see, boom, 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 who is going to give the correct answer? AL type of amyloid is seen. Excellent. So in primary amyloidosis, you see AL type of amyloid. First of all, you have the dirty table, classification of amyloidosis, types of amyloid, and which one you have to be very sure. Good. Zulfikar Harsha. Oh, Harsha did wrong. I didn't expect. Now, the next question, Doc. Blood-borne metastasis is unusual. It is unusual of all these 4 conditions. In the remaining 3, you have blood-borne metastasis. Where is it unusual? Good. 2 of you are right. So you should remember choriocarcinoma, renal cell carcinoma, osteogenic sarcoma, they're all blood-borne. Breast carcinoma is mainly lymph node. Good. Now, question number 4. Serum C3 become low and it is persistently low in all these conditions, except in one situation. Within 3 weeks, the serum C3 become normalized. So, good. Oh, none of you correctly answered. Oh, I'm sorry. Option A was not correctly designed. Actually, there it should be the post-streptococcal glomerulonephritis should be there in the option A. Sorry for the typographical mistake. Yeah. Now, question number 5. What is a characteristic feature of membranoproliferative glomerulonephritis? What is the feature which is so characteristic? Glomerulonephritis is the favorite question of the examiner. Hey, Yugender Bobby, even if you don't want to pay also, you can join the quiz for this time by giving a call to 9000868356. But please play it like a game on your smartphone. That will be real fun. So you want the link, please give a call to 9000. Right? Now, splitting, tram track appearance they call, no? Splitting of the glomerular basal membrane is characteristic of MPG, and that's good. That keeps Harsha on the top. Now, the next quick question. Annexin 5 is a marker of. Annexin 5 is a marker of. Boom. So it is a marker of apoptosis is what you need to remember. And Harshavardhan is on the top of the leaderboard. Oh, Yugender, you can also WhatsApp our helpline. Maybe they are receiving many calls to concurrently. So please retry in order to get the link. Melanocytes are stained with what? Mason-Fontana stain is the one which is used for the melanocytes, is what you need to remember. Good, good, good. Rajita joined the game. Rajita, our topper in the last morning session. Rajita, could you get your activation of 40,000 rupees worth of online MBBS.com, video library, full-scale grand test, 1 lakh PowerPoint slides, everything? You might have won the prize and got it. So please tell your friends, please send a video that you got activated and you are happy in watching that. That will help us to build a brand. right? So, good. Now, doctor, question number 8. Phagocytosis. Who discovered it? Oh, not my roommate, not my girlfriend. Who is that? So, is it Ehrlich, Metchnikoff, Selkis, Virchow? Who discovered? Wow. Metchnikoff is the one which you need to remember. I want all 15 of you who are online watching right now, you can always WhatsApp to 9000868 356 in order to get your link to the game for you to play, right? Yeah. So that's good, that's good, that's good. Now, excellent. Rajita is on the top. Once more, our past topper has the topping trait. Very strong. Excellent. Von Hippel-Lindau. Features include all except punch. So what are the constituents of von Hippel-Lindau? Boom. 3 gave 3 different answers. Except adrenal adenoma, hemangioblastoma, pheochromocytoma, renal cell carcinoma, they're all the features of the von Hippel-Lindau, the big list. You need to be very sure, doctor. Now, question number 10. These are all the causes of papillary necrosis. Oh my God. Another list to remember. But for entrance exam, you have to do everything. Papillary necrosis, what are the causes? Boom, boom, boom. That's right. Diabetes, sickle cell disease, NSAIDs, NR6. You need to remember papillary necrosis, the big list. Now, wow, Rajita is really running like a top jockey. Now, contributory negligence is a defense against what? Civil negligence, criminal, ethical, or what? It is the civil negligence where the other party also contributed to the negligence, not for the criminal negligence. Is contributory negligence. Contributory means both the parties have contributed. Mother and daddy, mummy, daddy, together spoiled the child. That is contributory negligence. So the child asked chocolates and the mother gave the chocolate. Contributory negligence. Wow. Julfikar shoots up. Question number 12. Pravalika Gubba. Please WhatsApp our helpline or call our helpline and join the game. You will get the link. You will get the link. Aseptic autolysis is typically seen in the case of the maceration is what you need to remember. Wow, Dr. Ramavat joined the quiz. So how did you get Ramavat? Did you pay 100 rupees or you got it free? It's okay. Even if you got it free, no worries. Actually, we want more number to play the quiz, enjoy a bit of technology and that excitement, adrenaline rush. But yeah, there is a little constraint for many to even affordable to pay that 100 rupees also, but it's okay. Let's play. That's more important. Now, doctor, question number 13. Should ketamite is a passive agent. So, is it a passive adult male, passive young male, boy, or passive adult female, or active agent? Yes. So, in the anal intercourse, passive young boy who is a victim of sodomy is called the catamite is what you need to remember. Wow! Now Ramavat joining the game has added a lot of excitement. Now, 14. In phenol poisoning, what is the urine color? Urine color. Come on. Punch, 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 punch. Is it brown, green, yellow, red? Green in phenol poisoning. Once more, list ko mar do. So there are totally around 1500 to 2000 lists will be there in all 19 subjects put together. We have all that available in the onlinembbs.com video library, doctor. So you get an access, and by participating in the quiz, you get an opportunity to become a topper and get the video library free, which is worth of 40,000 rupees. Now, the next question. Whoa, Julfikar. Next. Question number 15. Spinal cord is preserved in which poisoning? Boom, 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 adrenaline quiz. Boom, 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 adrenaline quiz. Who is going to give me correct answer? I know most of you will correctly answer. Yes, strychnine, spinal cord is preserved. So tomorrow's NEET PG also, 10 seconds mein decide kar lena. What is the answer? The more and more you keep practicing with Dr. Murali Bharadwaz, every day we conduct almost 4 to 5 quizzes. So please take every opportunity to be subscribed to the YouTube channel and play, learn a bit, get a topper, get a prize. That's how the preparation should go on and on. Gastric lavage can be done in poisoning in all except sulfuric acid. So, what are all the contraindications of gastric lavage? What are those specific case scenarios? You have to be very sure. Good to see. Hey guys, you are almost 22 are there online. I want to see you all joining the game. Still, the game is very young. So, please call our helpline to get the link of the game. Barbiturate excretion in the urine can be increased by. How is it increased? Ooh, alkalinization, not acidification, alkalinization. So that makes the only guy who answered correctly is Harsha. Excellent, Harsha. Now, question number 18. The fracture of the anterior cranial fossa may be associated with all this except. Yes. Fracture of the anterior cranial fossa associated with all except. Wow. Nasal bleeding, CSF rhinorrhea is in the middle cranial fossa, not anterior. That's the point. So, all of you missed the bus. Let's take the next. In the rape on a virgin, bruising of the vaginal wall is more frequently seen in which case? In the rape on a virgin, bruising of the vaginal wall is more frequently seen on the So, it is question number, the answer, only one correctly answered, anterior vaginal wall in the lower third. So, I just wanted to request I am requesting helpline to give free access to quiz link without payment. Yes. Yeah. So for this quiz, let us encourage more number to come and play and fight. Yes. So just give a access to all the people who call you. No worries. Yes. Now the next question, doctor. Question number 20. Already we reached 20 of 100. What is not included in death certificate? Death certificate में क्या not included? Cause of death, mode of death, manner of death, time of death. What is not included? But those who paid, the 5 of you who are playing there, obviously 20 questions you have moved forward. There's a great chance of winning 40,000 rupees, like our Rajita, who is the lucky person to pay that 100 rupees good investment, came to the top and then cracked 40,000 rupees worth of subscription. So, doctor, mode of death is not included in death certificate. So, doctor, all of you missed the bus. Next. Doing a retrospective chart review of unmatched cases of the controls, you need to be on the smartphone to answer this question. Expand that image, then you can see that image. Then only you can answer. So AD by BC will give you the odds ratio, which you should be in a position to calculate. Only one of you correctly did that mathematics problem. That is why is the only one who did it correctly. Now, a young child finds a bat lying on the floor on his room. The child picks it up to show to his mother and it bites him on the hand. So, what is the likely possibility? Very good. Simple. Not only dog bite, not only girlfriend bite, not only boyfriend bite, even a bat bite also can lead to rabies. You have to be 100% sure. Of course, human bite does not lead to. So, human is the dead-end host. Very good. Radhita, Harsha, Zulfika, Badhiya. Now, 23. Exactly 23 minutes. We are at 23rd question. Now, this question, you need to be on the smartphone playing. Then only you can be able to answer. Very good. The well water has been mixed with untreated surface or groundwater is what you need to understand. Good. Zulfikar this time is really racing very hard. There's a public alarm over the possible foodborne transmission of the bovine spongiform encephalitis. And you want to institute a investigation. So how will you do that? So doctor, you need to organize the systematic calling of pathologists and neurologists. That is the answer. So now, so that is the reason in any epidemic case, diagnosis is one of the confirmation of it is most important. You need to really read fast the question. Catch that single important point, Harsha. Otherwise, questions are going to come a little lengthier ones. This is all covered under ESI, except. What's your answer? Yeah. So, doctor, newspaper workers are not covered. Oh, option. Actually, non-option B should be different. Newspaper workers are covered. But non-power workers using factories with 18 members, they are not covered. Actually, option B, there was a typographic mistake in the last moment. Sorry for that. So there is a little bump in the question frame. Yeah. Now, contact time for chlorination is how much? Contact time for chlorination. It is a simple numerical single liner question. Yes. Very good. 1 hour. 3 of you are right. So that makes Ramavat to move forward very fast. Good, 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 good. Question number 27, which is not a barrier contraceptive. Boom, boom, boom. Punctuate answer. So, which is not a barrier contraceptive. Syntacron is not, but diaphragm, condom, today, they're all barrier contraceptives. That takes Harsha to be on the top, just by 1 point. So let's see who is going to beat it. A lady postpartum in lactation, best contraceptive. Is it triphasic pill, high dose estrogen, low dose estrogen, mini pill? What is considered to be yes? It is the mini pill. The best contraceptive is mini pill in a lactating mom. That's good. That keeps Harsha high by about 35 points. Now, question number 29, which is a killed vaccine. So let me tell you, actual NEET PG exam also will be similar to this. Not everything is really tough. Good. Hepatitis B is a subunit killed vaccine. It is a killed vaccine. Remaining yellow fever, Japanese encephalitis, measles, they're all live. Simple question, why only one correctly answered? Only Zulfikar correctly answered. Now, 30, question number 30, primary prevention plus secondary prevention denotes control, elimination, eradication, surveillance. What does it denote? Wow, 2 of you are right. Control is what you need to remember, primary plus secondary. Good. Harsha is good. But 100 points ahead of Rajita. Wow, is there any match fixing? Question 31. For this you need to expand the slide. 70-year-old man, shuffling guide, tremor, masked faces, rigidity, progressed over the last 9 months. ये सब बोलने के बाद अगर आपको पार्किंसनिज्म और डोपामिन याद नहीं आए तो you're missing. That's good. 3 of you are absolutely right. So all the classical clinical vignettes for the tomorrow's NEET PG exam, you have to be thorough and 100% sure on. Now, the next question. A 40-year-old man complains of cough, dyspnea, fever from 5 days. He also has diarrhea, red colored urine. His BP is 120/70. And all the remaining question you will only see when you blow up that on your smartphone while playing. So it is the diarrhea that should come to you, come to your mind. So, doctor, basically, yeah, The next question. 33 of 100. Confounding variable is responsible for what? In any statistical study? Easy question. Majority will answer. Yes. Good. Good. Indirect association. So that makes Harsha to be the king of the quiz game today, man of the match. Let us see. All these include discrete variables except. So discrete means plus or minus. Pregnant, no pregnant. Male, female. So good. Blood pressure is the one where you can calculate the mean value. It is not like yes or no. That's called, it's a continuous variable. Easy question. Wow. Harsha, Julfikar are scoring. How come Rajita did this question wrong? No, Rajita. Oh, you can then it should not be a problem because everyone is playing. Maybe your internet, you need to doubly check. Active immunity is acquired following clinical infection in all the following cases except polio. Now, '36. These are all the basic needs indicators used by the International Labour Organization, ILO, except. Wow. Except. So they use life expectancy, access to water, calorie consumption, roti, kapda, makan are very important to talk. So that keeps Ramaka Harshavardhan on the top. Now, which is called cradle of civilization. With civilization. So PSM is always a boring subject. So yeah, Mesopotamian civilization, Iran, Iraq. So only Zulfikar is good in history. Ramavat also good. 38. Ring immunization controlled which communicable disease? Which communicable disease? So, oh, nobody answered correctly. Oh my God, smallpox is what you need to remember. Next, 39. Which vaccine is prepared from embryonic egg and that can bring an anaphylactic reaction? One of the favorite questions of the examiner. Good. Influenza is what you need to remember. Come on, Rajita, you slowed down. Did Harsha fixed match with you? HLA B27 is characteristically found where? Where do you see HLA B27? Leading to seronegative spondyloarthropathy. In psoriatic arthropathy is what you need to remember. Polycythemia rubra vera versus chronic myeloid leukemia. What is exact? How do you differentiate? One very, very important clue, doctor. Wow, only two of you are right. You should remember paroxysmal nocturnal hemoglobinuria, sickle cell anemia, hypophosphatasia, and CML. LAP is decreased. Leukemoid reaction, pregnancy, polycythemia vera, aplastic anemia, multiple myeloma, obstructive jaundice, Hodgkin's disease. LAP is elevated. Please don't forget. Now, so by joining the quiz, most important is you will not get into that postponement syndrome. That is the idea, right? You need to every Sunday crack one full scale grant test 300 MCQs solve करके उस भूत को मार देना चाहिए. If you do that rigorously, practice for the next, what is now, Doctor? We are in July 3rd week. Barabar? So we still have August, September, October, November, December. Oh my God, 5 months. So now in this 5 months, you have every Sunday, means almost you have 20 Sundays, and December 1st to December 31st, every day we will have a full scale grant test like what we are having today. So as you keep playing, automatically how to answer with a lot of stress, a lot of competition, within 10 seconds can I be able to answer, otherwise how can I grow stronger? That inspiration you will get by playing the quizzes. So please call our helpline 9000868356. So somebody was suggesting, sir, instead of every game ke liye, instead of taking a payment, you take a monthly, some kind of a small fee, and give a promise how many quizzes every day. So I said every day around 4 quizzes, rapid fire quizzes of 25 questions. We will have. Every Sunday we have a full scale grant test conducted in this format. So almost all 100 quizzes we will conduct, and you can buy it like a subscription, and automatically you get the quiz link every time we are starting the quiz. So 4 quizzes every day, 4 into 25 days, Monday to Saturday, 100 quizzes, and 4 full scale grant tests. So this entire thing you will get for monthly payment of about a small fee of $2,000. So that way what happens is you are not even paying about 10-15 rupees in average. But more importantly, you are studying every day, you are playing quizzes every day, you are almost solving about 100 questions every day. That makes all the difference when it comes to tomorrow's preparation, right? Tomorrow winning. So think about it. And if you like to subscribe, please call 9000868356 to get this subscription. So 4 quizzes I promise every day, rapid fire quizzes containing 25 questions. And I will also try to get some other teachers other than me who can be able to come and conduct those rapid fire quizzes to make the whole show become interesting, right? Now, the next question, Doctor. 42. Multiple arthritis affecting small joints of the hand and feet but sparing deep joints. It is characteristic of what? Very interesting question. In fact, rheumatoid arthritis does not involve dip. Does not involve dip is what you need to remember. So that's good. Very good. Navina is into game. I'm so happy to see you, Navina. No worries. Yeah. We have now 6 players to fight. Last week, first time when I conducted, almost 85 players were playing and fighting. That is the kind of मजे में खेलना है हम सब मिलके. Antiviral agent active against the other viruses. Do the matching. What is accept about it? Good. Lamivudine, herpes is wrong. Otherwise, ganciclovir, CMV, emetidine, orthomix virus, and tribavirin, respiratory syncytial virus is what you have to remember. Very good. That keeps Harshavardhan on the top. Question 44. Type 2 respiratory failure versus type 1. You need to know the difference. Yes, where do you see type 2? Where hypoxia plus hypercarbia together are there. Type 1 means only hypoxia. Carbon dioxide is normal in type 1. So, very good. Bronchial asthma, pulmonary embolism, cryptogenic fibrosing alveolitis, they're all the classical examples of type 1, where hypoxia but normal PCO2. Of course, bronchial asthma in a very late stage can lead to type 2, but poliomyelitis. Why you didn't answer A? Oh, all were clean bowled. Navina, you should answer correctly and start the scoring. In cerebellar disease, whoever answers this, doctor, is the next NEET PG topper. I can guarantee it. Typical finding in cerebellar disease include all except is the question. Only one. Not the pendular nystagmus. Pendular jerks will be there. Who is that only one? Wow, Ramavat! You impressed me. Super Ramavat. So where do you see pendular jerks? Knee jerk will come, not pendular nystagmus. So pendular nystagmus is seen whenever there is any scarring of the macula or any macular hypoplasia or optic nerve hypoplasia. There are those conditions whenever there is any foveal disorder, you get pendular nystagmus, not in cerebellar disease. Now, 46. 23-year-old, you need to expand it. So you have been given a typical EEG in that on the phone you need to play in order to see these image-based questions. So complex partial seizures with the typical Rolandic spikes, that was the EEG which was given to you. Okay? Now, good. Next question, Doc. You need to make a fast decision. You're asked to perform a lower limb peripheral neurological examination of 45-year-old diabetic. So, once more, you need to go back to that question. You notice that the patient does not respond to any sensory stimulus on the medial side of the right lower leg. That is a complete question. Unless you are part of the playing the quiz on the smartphone, you can't see the whole question. So that is L4 is what you need to remember. I'm sorry about it to the online viewers. So, good. The next question is also a clinical denied. The patient has a 5/5 power in all the muscle groups. Cranial nerves are intact. MRI and CT head is being shown, there is a lesion. But he is having 0/5 power in all the muscles of the lower limb. So that is a classical clinical vignette of spinal cord involvement. So to localize the lesion is one of the favorite questions of the examiner. That's good. Now, a patient is unable to move his right arm or leg. When asked to smile, the doctor observed this problem shown in the image. Where is the lesion? Come on. Left brainstem. Left brainstem. You should know. Third, fourth, midbrain. 5, 6, 7 cranial nerve nuclei, pons. 8, 9, everything else is in the medulla. That's the point you need to appreciate. Good. Only Harsha cracked that clinical vignette. Question number 50. We reached the half the game. A light is shown into the patient and the pupil shows the following pattern. What is the diagnosis? You need to expand the image on your smartphone. Pump, pump, pump. So it's a swinging flashlight test, which is a sign of relative afferent pupillary defect is what you need to remember. Good. So question number 51. A 55-year-old has double vision. She's more tired than usual. Difficulty climbing stairs. By now you know it is myasthenia gravis. Now the question is, which is the sign or symptom most indicative? Fatigability. The pattern of fatigability is most indicative, is what you should remember of myasthenia. Good. Navina, you have to make the opening wicket. 55-year-old with double vision, she finds she's tired all the time, has difficulty in climbing the stairs. And what is the pathology associated with this female's diagnosis? There is myasthenia gravis. So quite often it is associated with thyrotoxicosis is what you have to basically remember. 5 of you correctly answered. Wow! I think Navina had a problem in access. Now I think she properly accessed. This time she should crack. Now, on observation, a patient has a left facial droop. And on closer examination, her face shows the following findings. She's unable to keep the cheeks puffed. Eye closure is only slightly weaker compared to the right. And her forehead wrinkles when she asked her to look up. So what is your diagnosis? So it is classically right middle cerebral artery stroke is what you need to appreciate. So once more, whenever any facial weakness is there, is it at the brainstem level or is it at the cerebral cortical level? You need to differentiate UM and LMN type. Now, the next question, Doc, 54. A female presents with diplopia. You have done a close examination, asked her to look right. Her left eye stays in the midline, but her right eye moves to the right. That means her conjugate gaze is affected. And what is your diagnosis? So typically it is internuclear ophthalmoplegia where the medial longitudinal fasciculus is affected, which is connecting the third cranial nucleus in the midbrain and the 6th in abducens in the pons. So that happens when there's a demyelination of the medial longitudinal fasciculus, which happens in multiple sclerosis. Good. Now, 55. A neurologist is examining the patient. You're being shown to you. What sign is he testing? What is the proper noun of that sign called as? Whoa, that is the Hoffman's test, is what you have to remember. Good. That keeps Harsha far flying on the, he is flying his fighter plane much higher. 69-year-old is taken to his GP. She complains that she has not been able to keep herself for the last year. MRI is being shown. She presented today with she is completely naked, urinating in the living room. So these are all dementia with the disinhibition features, which are the feature of frontotemporal dementia, which is called FTD. Good. Why is able to correctly answer that wonderful question? Now, 57. A patient presents with muscle weakness. You need to expand the slide. And on the neurological examination, his knee jerk is absent and he is found to have the following finding, which is a Babinski. So, what's your diagnosis? Oh, it is, in case of vitamin B12 deficiency, yeah, you have a UMN features in upper limb, lower limb, and LMN features in upper limb. But this is given the entire story, that typically is a finding which is seen in multiple sclerosis. Good. Now, a patient has difficulty in walking. His guide has been shown to you. And this kind of guide, which is like an arc when he walks, circumduction guide, where do you see? So it's very common. Hemiplegic individuals who come to your OPD, they all walk with this kind of guide. Now, question number 59. A patient is admitted with a stroke and a visual field defect is being shown to you. Now the question comes. Yes. Yes, Navina, I'm really sorry about that. So ideally you should join when the quiz gets started along with others. So this application has a little challenge. When you join in the middle, maybe the slides are moving slow. So shortly, another 2 weeks, we are coming up with a mobile app where you have tournaments every hour, a quiz tournament every hour on a subscription basis. You can play across the day with friends and get the prizes. So I'm waiting for our technology team to complete that mobile app and come up. Till then, we all need to journey with this AHA slides. But you need to join before, along with everybody. The other day, almost 85 people were playing. Nothing happened. Everyone is able to enjoy concurrent show, right? So For the next game, please call our helpline. Our next show will start sometime at around 4 p.m. 4:30 p.m. So when it starts, beforehand only, please give a call to our helpline. Call our helpline, and they will be happy to give you the link to the quiz for next game, for the link. Okay? Yeah. So, doctor, parietal lobe lesions lead to inferior quadrant myopia is what you need to appreciate. Now, a 43-year-old woman presents with dizziness to you. It started suddenly in this morning. She awoke with a headache and a giddiness, and the remaining story blah 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 was given. What's your answer? So you should recognize how a BPPV, benign paroxysmal positional vertigo, typically presents. Very good. Harshavardhan is really rocking in the clinical VNet-based questions. Excellent. So Ramavat and Rajita need to run. So Ramavat, Rajita, Julfikar, is your internet fast? I think it is fast. Now, 61. A 40-year-old seen with these multiple fleshy nodules, there are also freckles. What is your diagnosis? Neurofibromatosis type 1. Beautiful. Now the next question. A 19-year-old being admitted, he was doing push-ups, then sudden onset of a severe headache and collapsed. CT head was shown. So CT head was shown. What will you expect? So typically, it is a subarachnoid hemorrhage. That's the reason along the sylvian fissure, you find the blood is what you need to remember. Now, good. 63. A 6-year-old with visual problems, giddiness, he sees the room spinning around, right? A CT was being given to you. He is also having nystagmus, dysdiadochokinesia. That's right. That makes it a posterior circulation stroke. Good. Harsha, Rajita, Julfikar, why are going strong? 64. Once more, you need to expand the slide. A 45-year-old, 5-day history of progressive tingling, numbness, blah, 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 blah. The whole story was given. It was the story of post-infectious demyelinating polyneuritis Guillain-Barré, based on the clinical history. But if you're on that quiz, inside the quiz game, you can be able to expand the slide. Now, so this is what was his imaging finding. 65. A 36-year-old man with neurological symptoms. He's able to stand with his feet together. But on closing the eyes, typically he falls. What is your diagnosis? So that's called wash basin phenomena, which occur whenever your dorsal columns are defective. So proprioceptive problem lead to wash-based phenomena? Good. Next talk. A 90-year-old man comes to the accident and emergency with a 2 weeks history of fever, lethargy, night sweats. There's a pansystolic murmur. Endocarditis is suspected. Which organism? Actually, there was a picture of organism. Oh my God. There was a typographic error. A picture was shown which is Streptococcus viridans. Without picture, only 2 of you correctly answered. That's good. Yeah, that keeps Harsha and Zulfikar rocking. So this was the picture. Actually, it should be there in the question. Sorry, our DTP guy misplaced it. Yes. A 45-year-old man, homeless, itchy rash. The rash is very much in the night. So based on the clinical image, what is your diagnosis? All of you will correctly answer. Very good. Scabies is your answer. Good. Tomorrow's exam also you should answer 300 questions in each 10 seconds. 1 घंटे में खत्म करके छोड़ देना नीट पीजी एग्जाम को. Once you are practicing with me at this speed to make the right answer, you will become reflexively very strong. Now, 20-year-old man comes to emergency. The joint was aspirated. Blood culture was taken. Organism is shown. What is this organism? That's right. Neisseria gonorrhea. Solid. All the 5 of you correctly answered. Beautiful. 69. So this patient knee is swollen. Once more. Organism is shown. So what is that? Which is being shown? Good. That is Staphylococcus aureus. Only Harsha was right. 40-year-old, 3-week history of shortness of breath and dry cough, fever and malaise. He has been HIV positive for 10 years. Bilateral perihilar interstitial shadowing. What is the organism? Pneumocystis. Good. Her hair is rocking very big. A 40-year-old man, 3-week history of retrosternal discomfort after swallowing. He was HIV positive for 10 years. And the esophageal biopsy is shown. Wow. 2 of you are right. Candida albicans. Only Rajita Ramawat have rocked the correct answer. Yes. 72. A 40-year-old man, HIV positive, comes with these lesions. They are due to what? They are the classical Kaposi sarcoma. Wow, Harsha, very good. 73. 42-year-old with blotches over his legs. HIV positive for 10 years. So looking at them, you know it is Kaposi, but Kaposi is because of what? Human herpes virus 8, HHV 8. Good. Now, 74. A 40-year-old man with deterioration of the vision with the presence of floaters, and he has been fundoscopy findings have been shown. That's right. It is a classical case of CMV retinitis. Good. A 42-year-old comes to emergency with a one-day history of headache and fevers. CTP presented to you. Please expand it. You should be there on the game to do that. To be on the game for the next game, please call our helpline doctor 900868 to get the link so that you can enjoy playing. But now only you ask for the link. By 4:30 p.m., we will start the next game. At least there, I want to see all of you along with your friends. Come on to the quiz and rock the show. That's good. Toxoplasma. Good. That keeps Harsha on the top. The risk of spontaneous cerebrovascular accident in the children when they have congenital heart disease, when will it be there? Is it right to left or left to right? Which kind of shunt? It is the right to left, not left to right. So, tetralogy of Fallot, polycythemia, then all the risk factors for developing a spontaneous CVA. Good. Harsha Ramawat only correctly answered. 77. What is the first approach to the therapy of supraventricular tachycardia? Punch your answer, doctor. That's right. Oh, first approach is not carotid. Even before that, you can use ice and saline bag placed on the face. That is vagomimetic and slows down the SVT. After that, carotid massage. Carotid massage is like a double-edged sword. That is, you are putting patient in risk of getting asphyxial death. Oh, all of you lost it? 78. Acquired anti-factor VIII antibodies. How do you treat? You don't use any immunosuppression. You do plasmapheresis, factor IX concentrate, porcine factor VIII, etc. Wow. 79. A 14-year-old, he had fever for 3 weeks, firm non-tender 4 centimeter right supraclavicular node, given all that history. That's right. PA and lateral chest films, please don't forget, only PA is not enough. PA plus lateral film, both of them you need to take. Good. Question number 80. A 2-month child, sickle cell anemia, came for screening. And what is the appropriate measure for the treatment of this child, except? Right. So, you need to be quite sure. How do you manage sickle cell? Now, doctor. '81. The height of newborn doubles. This all of you correctly should answer. If you miss this, you are in amoeba stage in pediatrics. Oh, 2 only correctly answered. 4 years. Absolutely. So when we'll write double weight, double, all these things, be very sure, developmental milestones, exam is going to kill you. 82. The most common cause of short stature, छोटू, कैसे बनता है? That the late bloomers. Yes, constitutional is most common. You made me proud of you. Excellent, doctor. Now, '83. 8-month-old baby will be able to do which of these? 8-month-old baby will be able to do which of these? Stable sitting. 8-month-old baby will be able to do stable sitting. Now, Harshavardhan is rocking with the correct answer. Once more, you have done 2 questions wrong in developmental milestone means अब भी बैठ के पढ़ाई करना है. एक बुक में लिख के रखो, बैठो. Malnutrition, how do you assess clinically? So, all these can be used very much. Now, 85. The most common cause of short stature, of course, this is a repeat, constitutional. Yes. Sorry for the repeat. These are all true about marasmus, except marasmus. What happens in marasmus? Edema is in kwashiorkor, not in marasmus. '87. Intraosseous fluid therapy. किस हड्डी में देते हैं? Which bone will you administer? Very good. 4 of you correctly answered tibia. Wow. 88. Fetal lung maturity, how do you assess? Fetal lung maturity by all except. Four of you are right. Foam stability test, LS ratio, amniotic fluid, phosphatidylcholine level, they're all measures to assess the fetal lung maturity is what need to be remembered. '89. Hyaline membrane is sealing. Easy question. Yes, in respiratory distress. Question number 19. Commonest cause of congenital hypothyroidism. Let us be very sure. Yes, doctor. Commonest cause of congenital hypothyroidism. Who is going to give me the correct answer? Wow, 3 of you. It is the thyroid dysgenesis is what need to be remembered. That makes Harsha to reach almost 4,000 points. Good. Question number 91. Lupus pernio. I think all of you will kill the correct answer. So lupus pernio, where do you see? Yeah. All those fleshy lesions on the skin. 3 of you are right. That makes sarcoidosis the correct answer. Now, doctor, that brings Harsha to a rocking score. Last 8 questions to decide who is going to make that 40,000 rupees prize. Eruptive xanthomas is seen in all these hyperlipoproteinemias, except who is going to give me the correct answer? Boom, boom, boom. Yes. Punch your answer, doctor. Very good. 2 of you are right. So type 1, type 4, type 5, in all that you see eruptive xanthomas. Great. This is a little luck. Julfikar is right. 93, the countdown begins. Who is going to crack that jackpot? Tombstone row of basal cells attached to the basement membrane. What is that vesico-bullous lesion where you see? Whoa, pemphigus vulgaris. Only 2 of you. Great. Y and Harsha, but almost 1,000 points difference. That makes Harsha unbeatable crownless king. Very good, very good. Paraneoplastic pemphigus most commonly is associated with what? Come on, punch your answer. Paraneoplastic pemphigus. Oh, see, all of you are massively clean body, non-Hodgkin's lymphoma. 5 more questions. Carpet track sign where follicular plex with removal of a scale is a featured semen. Come on. Dermatology is going to be a quagmire. That's great. Discoid lupus erythematosus. Absolutely. Now, '96. Which anesthetic topically applied except tetracaine, lidocaine, cocaine? They're all topically applied, not bupivacaine. Wow. Harsha and Y are having a street fight. Rajita also joined the game. Oh, Rajita this time gave a way to the Harsha. Cimetidine decreases the hepatic clearance of local anesthetics. All this except which is not dependent on P450. Oh, except procaine. Procaine. Now, doctor, last 3 questions. If I were to increase it approximately what percentage of each liter per minute increase in delivered oxygen flow when you are giving nasal cannula up to 6 liters per minute? How many of you are good in critical care? Absolutely. 4%. Only one correctly answered. Who is that one? That is Rajita. Correct. Rajita want to prove, sir, I am not into match fixing. I am going to go to the top. Very good. Very good. Very good. 99. What is the main side effect of D-tubocurarin? Main side effect. That's right. Hypotension. Hypotension is the main side effect. The last question. The last question for today's evening. 100th question. Who is going to correctly answer? Our next quiz is at 4:30 p.m. Doctor. The remaining last set of 100 questions we will finish. Okay. So if you want to be part of the quiz and play the game, please call our helpline 900868 Excellent. Mivacurium, decreased plasma cholinesterase activity with the liver disease, typically can affect mivacurium. Though mivacurium belong to the curare group, still mivacurium is the one typically decreased plasma cholinesterase will prolong the effect. Now, doctor, let us take the crown and put it Harsha, Harsha, Harsha. Excellent. Very good. I'm very proud of you, Harsha. At last, I was waiting when we will get the chance to see Harsha winner with 40,000 rupees worth of onlineMBBS.com Video library, 65 full-scale grant tests, 1 lakh PowerPoint slides of notes, and Dr. Murali Bharadwaz. Everyone is being, is all yours. So please call our helpline and get your instant activation. And all of you for joining the game. Thank you so much. So 4:30 p.m. we will play the last game. Okay? And I want, if you have not yet joined, please call our helpline to get the link to join the game. 5 minutes before only you want to get into the game, after getting the link, so that we will all fight together and see who is going to be the winner. 9000868 So guys, at last, we have reached the end, and now you understood. It is not the intelligent, it is not the brilliant, it is not the genius or an Einstein who will be the winner. What is required to be a winner? Perseverance. To keep going, keep going, keep going, keep going until you win. That is the character which is being tested very hot in the NEET PG tomorrow. And I know you're all Dr. Murali Bharadwaz Super 1000 batch, and you must be in the top 1000 ranked. We will all catch up at 4:30 p.m. on the next game. Be in continuity with the YouTube channel. Thank you.